Hello. Good morning, Mr. Baker. How are you today?
Good morning or good afternoon.
Or good afternoon, or you know what? Somebody could be watching this in the evening. We don't know, right?
Exactly.
We shouldn't project what time of day it is someone is watching us. This is
Exactly.
the Baker Senior Show, and we talk about Medicare. We talk about all things Medicare. Today is very specific about switching. So, why and how you can or why you should switch your Medicare.
hmm
So, do they call them programs?
Uh, yes.
Okay.
Yes, we could call it that.
Why or how or both you should switch your Medicare program. I'm sure there's a lot of reasons and there's a lot of different ways that you can do it. And Steve, you're going to tell us all about it.
Okay. Well, we're talking in these programs about all aspects of Medicare, and I ran across a situation where almost nobody talks about, and I wanted to talk to you about Medicare. Typically, what happens, and those of you who've been watching our show know that I'm on Medicare myself and have been on Medicare for quite a while. So typically, what I do is I tell people just get on your program and stay on it. And if especially if it works for you, if for some odd reason it doesn't, then you definitely do need to make some changes or move in a different direction and so forth. But typically, what'll happen is that you get on a program and you stay on that. And I was talking to a couple of clients, husband and wife clients, yesterday, and one of the things about Medicare, especially, again, we want to go back that there are two kinds of Medicare. One is traditional Medicare with a regular supplement, and the other is the Medicare Advantage program. So you're either on one or the other, and both of them have different rules from each other. But if you're on a traditional Medicare, one of the things that happens over a period of time is that the premiums go up. It's what's called getting in older. And as you get older, the premiums will rise. And I warn people about it early on, and I'll just tell this, it's just called the official name for it is attained age. So you have attained age, and it just gets older. A few of the companies go up more than others, and so I encourage all of my clients to check with me on a regular basis, an annual basis, and they do when they get a notice that their premiums are going to rise. So in some instances, I'm able to help them directly, particularly if they're in good health. If they're in good health, we can go. We have to re-enroll, and you have to, unlike when they first signed up, the health questions come into play. So if we want to move over to another company in that regard, that I can check prices for them, and in certain instances, I can change them over if they haven't developed any major illnesses or any major diseases and so forth.
Steve,
So
I'm going to slip in here a question about that. So, let's say you just said if you haven't developed any major diseases or conditions, but
mhm.
what if you have something that goes wrong, like you're in an accident and you break your bones? Is that totally different, or is that
No,
what you're
no, that
talking
wouldn't
about?
be, because that's something that can heal over, and that's something that,
Okay, all right. So a
so
condition
yeah.
or a disease that is
Mhm.
lifelong.
Yeah, like cancer, or any major thing, like heart disease or anything like that.
Right. Okay.
So that could be a long-term effect, and it would be difficult to switch over to another company. because you have to ask the questions in order to switch over. This couple, I'm getting ready to switch both of them over so that they can get a lower premium, and I don't think they're going to have any problems because they've just been going on. They see their doctors, and they have colds, and they have the normal stuff that you would have, but nothing major has come up and cropped up. So they're able to change it, in that situation. And now over on the Medicare Advantage side, that situation is totally different. Medicare Advantage has a period from October 15th through December 7th where you can change without any health issues whatsoever. You can move over to another company.
Steve, why do they do that? Why do they have a certain time when it's like a free-for-all? If you come in at this time, you can do anything, and there's no repercussions, and no health questions. Why do they do that? Why can't they just have that all the time?
Well, the reason is that traditional Medicare and the Medicare Advantage work on different frameworks totally. So what they do on the other one, the only real reason you would want to change over from traditional Medicare is because of price only. On the Medicare Advantage side, a lot of times you'll see on TV 0 premium. So you're not actually paying a monthly premium as such. In a few instances you are, for a PPO or something like that, you'd pay a small monthly premium. But typically you don't pay a monthly premium. So there's no incentive to move for that reason. There are other reasons you can look at. But the CMS, the Center for Medicare and Medicaid Services, sets the rules and just says, okay, if you want to change, you can change, but you have to do it in this period of time. So it's just set in a standard, and everyone knows what that is. So you can make a change, and it's fairly easy to do in that period of time. So let's say, for example, you're not happy with your doctors.
Right.
On the traditional side, that doesn't come into the equation, because if you have traditional Medicare with a supplement, you can go to any doctor you want to. So if you don't like your doctor, you just simply go to another doctor. But on the Advantage side, you don't have that privilege. So that's one of the reasons that you might want to change. There's some
a reason I would want to change. If I didn't like my doctor, or I didn't feel I was being cared for in the way that I wanted to be cared for, I would want to be able to change. I don't think I could ever get on a system that said, you have to stay with the doctor whether you like him or not.
Mm-hmm.
Who would want to do that?
Yeah, well, that's just one of the trade-offs that you have in the Advantage program. On the good side is that you're not paying a monthly premium for it, except in the instance of the PPO. But you're not paying a monthly. So you're paying 0 premiums, so they say, when in the advertisements during open enrollment. So there's no reason. If you're 0, you're 0. But there's some certain situations, that you might want to look at changing. And I would contact your agent. Your agent would be able to discuss with you your options. Another real reason on the Medicare Advantage side to change is if you happen to move out of your area. If you move out of your area, then the plan that you were on in your previous residence might not be available. If you move to another county, or if you have to move to another state because you want to be closer to your children or so forth, then you've got to look at the option, and that sets up a possibility, what we call a SEP. That's a special enrollment period. So you're not confined to that October 15th through December 7th window there. You can do that any time of the year and get what we call a SEP. So if you qualify for a SEP, special enrollment period, you have a lot more freedom there.
Very good. I was wondering what that special enrollment was. So they will take into consideration certain aspects if you are moving or have some other issues. And who decides that, Steve?
CMS, the rules that CMS sets up, and a professional agent that you can look to that, and they can check. You can contact Medicare, 1-800-Medicare. You can give them a call and see if you have a special enrollment period, and if so, you're able to move. And let's say that for instance, on the Medicare Advantage side, that you're entering a long-term care facility or something like that, you're going into a nursing home or something like that, then you would need to take a look at your coverage and see how that changes. Again, if you change it, you're just not restricted to your October 15th through December 7th, your annual enrollment period. Again, that would trigger an SEP for you. So you can take a look at changing at that time.
And that's what happened to the referral I gave you, correct? She was moving into a personal care home.
Exactly.
And she needed to change, and so she didn't have to wait till the special time of the year.
Yes.
Okay. Yes. And you were able to handle that for her. All I had to do was call you, and you looked into it and found the right plan for her, which I greatly appreciate and thank you for.
Yes. So we were able to take care of that situation because she was going into a home, and that was, in her case, it was assisted living. So that's the official title for where she was and is assisted living. So we got an SEP for her, and then we moved on down the road. It worked out really well.
It did work out very well. There's so many different considerations and different aspects of our lives that require certain changes. So that's one of the reasons why I love people to be available. I mean, to be aware that they can call you, Steve, and you can steer them in the right direction.
Sure. Glad to answer any questions. For sure. Now the other thing is, it doesn't occur a whole lot in a situation, but what if the plan drops you? The plan just drops you, and really that doesn't happen a lot, except if you're on a program. Then you may be able to get an SEP if your premium. Let's say you're on a traditional Medicare, and this, as I pointed out earlier, your premiums start inching up year by year by year, and you just come to the conclusion that you simply cannot. You and your family comes to the conclusion that you simply cannot afford that on a monthly basis. Then you're able to switch over to a Medicare Advantage, and you may, and I'm not going to all the details there, but you may or may not be able to get a SEP for that. But whenever the AEP rolls around, for sure you could switch out of a traditional Medicare into a Medicare Advantage, and for a few people that does work for them. Or let me put, instead of saying a few people, some people. That could work. And again, you need to contact a qualified, experienced agent to help you make that switch.
And are you that experienced agent?
Yes.
See, that's exactly what I'm talking about. If you'll notice, right down below, either in the banner here or down below in the description, you're going to find Steve's phone number. And he really wants to be able to talk to you about this. whether it's for you, a neighbor, or someone that you really care about, a family member, even someone you work with. If you have questions about Medicare, call 832-754-3292 and just talk to Steve.
Mm-hmm.
Even if he can't help you, he is going to steer you in the direction that you need to go.
Mm-hmm.
So he'll talk to you about a lot of different things when it comes to how you can handle your Medicare and your questions about your health coverage as we age. Once we turn 65, let's face it, we all are looking at Medicare. And that can mean so many different things. I have learned so much just by talking with Steve and going through a few scenarios. I gave him a referral for a friend of mine whose sister was going into a personal care home. She really needed the doctor to come in. She didn't need to be going out every time she needed to go to the doctor.
Mm-hmm.
I'm sure there's certain circumstances where she's going to have to go to the hospital or go to the doctor, but for the most part, they can come right to her. Now, I wouldn't have known that.
Mm-hmm.
Steve was able to find a doctor that took Medicare, was able to come to the home. He was also able to find a pharmacy who could deliver the drugs, her prescriptions to her. Not the drugs, but her prescriptions that she really needs. Everything is contained inside this program that he found for her.
Mm-hmm.
And I can't even tell you what a godsend Steve is, because he not only is experienced because he also has Medicare, but he has been doing this a long time and he has a lot of stories that he can tell. And Steve, I always want you to share some story of a real life person that you've worked with that maybe has gone through a change, because that's how we learn stories. Do you have anybody you can pull out of your memory banks that you could tell us why they changed, how they changed, and how it worked out for them?
Well, I'm working with this couple, and I think I mentioned it a little earlier. That's fresh on my mind about their premiums, and I actually started them off. They've been with me for years. I started them off with one company, and that company had the reputation of raising their rates dramatically from 1 year to the next. And I saw right away, after a couple of 3 years, that their rates were beginning to spike. And different companies raise their rates. They're not all even. And as an agent, we really don't have any insight as to how quickly the rates. I'm talking about on the supplement side now, on what we call traditional Medicare or Medigap. Medigap and Medicare or Medicare and Medicare supplement are interchangeable in terms of terms. So their Medigap policy was going up dramatically. And so they were still healthy and everything. So I was able to take them and switch them over to another company. And that rocked along very well. And it's the very company that I'm with myself. And so I knew that I know how my rates are going up and so forth on a monthly basis. And that it's not like they go up, $40, $50 a month or something like that. They kind of inch it up. Sometimes I don't even have a rate increase in mine, but then again, next year I may have like $8 or $10 a month jump. So I was able to switch them over, and then the company that I switched them to now has started jumping up. So now I'm sitting down with them a second time to take a look at a third company that my wife is actually on this one as well. And so I'm able to maybe drop it down dramatically, maybe $30, $40, $50 a month for them, to save them that a month each.
Wow.
So it's it pays to stay in touch with your agent and then see if they can make a change. Again, the caveat there is your health. If you've had major health issues, then you may not be able to make the switch. So that's just the unfortunate reality of Medicare these days. So that's it. But we can always work around and perhaps find a solution. We may be able to get an SEP, and maybe not. But if not, we can wait until the open enrollment period and make a switch over to the Advantage plan. That's always a possibility. There's always something that can be done to help the situation. So it's
Well, that's a good point. So if your situation changes, you should call Steve and say, look, this is what's happening to me. What are my choices? What are my options here? Because there are some, and you just happen to know about all of them. So if they're going through something, you can look in your bag of tricks and say, okay, so you're moving. All right, this is what we need to do. We need to, do this and do that. And not that you're going to take care of everything for them, but at least they know what to do. They know their options. Because if they make the wrong option, if they make the wrong choice by just, talking to their neighbor and doing what they did, that's what people do, They listen to their older sibling, or their neighbor tells them what to do, and they don't get the right advice. They might have to wait a whole year in order to switch it back, or to switch it to what's better for them.
right. Yeah.
Knowledge is power, is what I'm saying.
Yeah. Especially when you're talking about Medicare, that's for sure.
And it is very confusing. There's so many moving parts. As we laughed about last week, there's A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P's. There's all these different choices, and there's two different kinds. And then you also have the problem of getting with the wrong agent who wants to just try to sell you something.
That's correct.
And so I know with you that would never happen. Every industry has that. I'm not saying that, Medicare is full of agents who are not on the up and up. I just happen to know that there's every kind of person and every kind of life experience. And I have found that I trust Steve Baker, and he would never steer anybody wrong. He always wants to do the right thing, whether it makes him money or not. He's willing to take the time to talk to you about your situation. Even if it's not for you, even if it's for someone you care for, or a neighbor or a work buddy, he's willing to take the time to do that. And you don't find that everywhere. So I just want you to know that Steve Baker is the person that you want to call if you have any questions about Medicare. What other situations can you think of, Steve, where someone might have to switch, or they should switch?
Well, if there's been, and this doesn't happen a lot. I mean, I've had it happen a couple of times in a certain situations. Let's say that they're with an Advantage company, or even I'm going to say never happens when you're in traditional Medicare with a supplement. But there could be occasions where there's an actual contract violation.
What does that mean? I don't understand.
Well, the company has they're just not doing what they said they would do.
Oh.
And if that's the case, we can take a look at it and talk to Medicare about the situation. And in that situation, that would trigger actually an SEP. So that could be a possibility, but you have to really nail it down, and you have to be specific, and you have to make sure that the company is actually violating their contract with the company. And in that case, it could get very, very serious. So, but I've had that in my years with Medicare. I've had that happen once or twice, but mostly it doesn't happen.
So, Steve, let's talk about companies. So let's say you're part of a company you who are watching this,
Mm-hmm.
you work for a major corporation, or you're with a company that has, 50, 100, 500 employees. Did you know that you could call Steve and Steve could come in and do a presentation or talk to the HR department and make it easy for everyone there, especially the people that are starting to retire? The HR departments are just overwhelmed with all the work that they have to do to support
Mm-hmm.
you, the employee. And
Right.
so if you were to just let Steve know that you could have him come in and do a presentation or just talk to the HR department, it would help you and it would help your coworkers and it would help the company you work for. Steve, what can you tell us about your presentations and how you help companies?
Well, companies are, they're really the human. I'm learning a lot about human resource department, because there's a lot of issues that they have to address all the time, about complaints and work issues and this regulation and that regulation, and how do you approach this. And someone has a major issue, they feel like that they've been abused or some form or fashion, so they're handling all that kind of stuff. And you throw in the benefits there at that time, then that adds extra. So I'm able to come in and just pretty much just explain Medicare to people who are in their 60s, getting ready to decide whether they want to continue to work or not. And I could explain the benefits of going ahead and taking Medicare and maybe continuing to work, depending on the company situation and so forth. So I can explain options. Let me put it that way. Explain options.
And do you charge the company or the
No,
person for this?
no, there's no charge for that. I just come in, talk about Medicare and what's available out there, and so forth. So it's just more educational than anything.
Well, I would think that you would be very busy going into a lot of companies, especially right now when their focus is on just staying alive. The
Hmm.
company, I mean,
Right.
just staying alive because of all the virus and all the closures and the layoffs and all the things that are going on. You would
Hmm.
think that they would want to outsource all that to you because that's what you do, that you're an expert in it. And
Hmm.
then they could focus more on what is like right in front of them.
Right.
This all these problems that companies are having.
Hmm.
So how would that work, Steve? Would they just call you? Should they have you call the HR department? And how do you see that happening?
Well, it all occurs with this one phone number, and every situation is different. So I will take a look at their situation and give them some advice on what to do. And if they could give me the name of their HR person, I can discuss that with them and send them some information and about it. I have a little video that I could send out to them as well. So.
Fantastic.
Mhm.
Do you have any last words for us today on switching their Medicare
I
program?
think I think we've pretty well covered it.
Okay. Well, thank you for watching. Steve Baker from the Baker Senior Show. We're talking about Medicare, all things Medicare. If you have any questions, if you want to talk to Steve, if you have an idea for us, please let us know. 832-754-3292. And we're live here on Facebook and YouTube every single Tuesday at 8 o'clock Central Time. So if you would like to come on the show or you have an idea for us, we want to hear from you. Thank you for joining in today, and we'll see you again next week. Bye for
Bye.
now.